Good morning, guys. Happy almost Thanksgiving break. This is Miss McLean reporting live from Germantown High School, where she is off today at 3:43. Not rubbing it in. I'll be seeing y'all Monday for our electrolyte level lecture. And I have clinical on Saturdays. It's not like it really starts until after Monday, but I'm just super pumped. I don't have to be at work on Monday. Anyway, today we're going to be talking about complementary and alternative therapies. So I wanted to share with y'all some deep breathing exercises that I absolutely love, that I use all the time. Um, it's a little fabulous how I have it all rigged up, because I am using my MacBook, my iPhone, and my iPad. People, it's getting real here on the techie side at Germantown. Okay, guys, are y'all ready? Let's take a moment to close our eyes. And I'm having people check and make sure y'all are actually closing your eyes. To take a moment and deep breathe.
Let's begin by finding a comfortable position. And now close your eyes. Simply be aware of what you're experiencing with your eyes closed. You may notice thoughts, sensations in the body. You may be hearing noise. There could be some emotions present. Simply being aware of what's happening without trying to do anything about it.
Okay, that's enough of that because I'm pretty sure you're like, please make this lady hurry up and talk so we can go. It's Friday and we've got tons to do. So that's exactly what I'm going to do. So today we're talking about complementary and alternative therapies. Your PowerPoint is uploaded in Moodle for y'all. Again, just read over it, kind of know what we're talking about. I was told that I picked terrible test questions the last time, and I apologize. Y'all can all voodoo stone me. It's fine. I completely and totally understand. So I'm going to do a better job this time of making sure I pick questions that facilitate a decent grade for y'all. Okay, guys, so we're talking about complementary and alternative therapies. I'm not really, I say granola in a laughing ha-ha kind of hippie organic way, um, but I'm not really granola. I don't organic, I don't essential oils yet. Excuse me. But I am a fan of touch therapy, massage therapy, um, the importance of setting a proper healing environment. Those are all things that are so true to the world, even though they do seem a little far off and kooky. Um, they are real and they are important. So, what do you think are some complementary and alternative therapies that our patients may be using? Kaylin? Okay, I'm sure you said exactly what I was trying to ESP you. Massage therapy, essential oils, um, vitamins, herbal supplements, all kinds of stuff. Gluten free, kind of sort of an alternative therapy. But people are doing a lot of things these days because they do realize how their bodies are affected by chemicals and processed foods. So people are really, really, really looking into that and doing those kinds of things. The sooner that we all realize that Western medicine isn't going to fix everything, the better off I think that we'll be. So what's interesting is that I find that people, or the people that I know anyway, that aren't granola use them because they want to feel better. I have a friend of mine who goes and sees a special person that does something with the hands and fills the energy fields and gives them supplements, and it makes a world of difference with her husband's mental health and her physical health. She's got a lot of irritable bowel type syndrome stuff, and so that really helps her. There is some research, there is some evidence-based practice behind these things, and so it's really important for us to be open to them because our patients will more than likely use them. What's interesting is 75% of patients of our population seek treatment from their PCP or primary care provider for stress, pain, and health conditions that there are no cure. Okay, we can't make stress go away. We can't make pain go away. We can't make anxiety go away. I mean, we can try to medicate it away, but it's not going to work until you find out what's at the root of those things. And so these alternative medicine therapies really do help ensure and give our patients another option to help them feel like they're in control. Okay, so here's our case study. Joan is...
If you are not using one of the front office gray carts, we need those back. If anyone has a front office gray cart, would you please bring it to us? Thanks so much. Bye-bye.
Sorry, guys. Somebody better turn in that gray cart because Miss Lori does not play. So Joan is under a lot of stress. A lot of stress. Y'all, as nursing students, are under a lot of stress. Your curriculum is fast-paced, it's in-depth, it's time-consuming. The expectations that we have for y'all are very high. We expect the best performance. We let you know when you're not performing to our expectations, and so you're under a lot of stress as well. So Joan is 46, newly diagnosed with hypertension. She works full-time. She helps take care of her widowed mother and is raising a family of 3 children with her husband, Thomas. Okay, sweet little Alonzo is a nursing student assigned to Joan's care in the clinic. Joan is skeptical about taking antihypertensive medications and asks Alonzo about alternative treatments. Some of our patients will be very, very, very hesitant to take not over the counter, but even over the counter prescription medications. Just their past history, where they are, their culture, their situation. Where they are just in their life, they may or may not be able to afford medication. So it's going to be important for us to understand those situations. So how would you approach encouraging Joan to give the prescription medicines a chance? What would be the most important thing for you to do? Okay, I'm going to hope that you said establish trust with her. It's very important to establish trust with our patients. So let's see. Okay, so just an overview of different therapies. You've got CAM therapies, which are complementary and alternative medicine, is an array of healthcare approaches with a history of use or origins outside of mainstream medicine. This means that it's not in your pathophysiology book or your pharmacology book. Complementary therapies are used in addition to Western medicine, and then alternative therapies are replacing. This is allopathic, is the word for Western typical healthcare medicine. And alternative takes complete and total place of our Western medicine. And then the whole medicine systems are based on philosophies of life systems. Y'all will see as y'all get into healthcare that there are really 2 types of doctors. There's a medical doctor and there's a doctor of ortho medicine, a DO. And that DO really does have more of a focus on these complementary therapies. It's a different approach, just like nursing is a different approach than medicine. Medicine's very rigid, very single-minded. Osteopathic, there you go. Osteopathic medicine providers have a whole system approach that they're taught, much like we are in nursing school, and they do talk a lot about alternative therapies and such. Okay, so let's go back real quick. So what are some complementary therapies that we may want to talk about or you may want to be aware of would be massage therapy, for massage envy, acupuncture, meditation, herbal supplements, going to the chiropractor. A lot of people do that and find relief from that. Alternative Therapies, like we said, replace Western medicine or replace allopathic medical care, and that's like folk medicine, healers, Chinese medicine, those types of things. Really don't necessarily see a lot of the alternative medicine, but when you come in contact specifically with Choctaw Indians, you'll notice that they have a very interesting alternative medical path. They have their folk healers. The same thing with some of our Hindu population. They have a folk healer that is very important to their health care. And so we have to embrace those. What's the word I'm looking for? Y'all, it'll come to me in a minute randomly. Where you have to kind of work out and come up with a good understanding of what both of the roles are, your Western allopathic medicine and your folk medicine, to make sure that our patients get better and that they have the right options. Okay, so complementary and alternative and integrated approaches to healthcare. Holistic nursing regards and treats the mind and body of the patient. Nurses typically do this anyway. This is how we're trained. We're trained to look at the whole system. Don't know if y'all have talked about nursing theories yet, but Betty Neiman's systems theory is by far my favorite nursing theory. Did I just lose cool points? It's okay. I'm used to it. I love her idea of systems theory, how every system involved in the patient's life really does integrate and affect the way that the patient is feeling and how their health care is going to come out and what their quality of life is going to be. And as healthcare providers, we really have to understand the role of each sphere of influence in their lives in order to really provide the best care for them. Uses of holistic nursing interventions, y'all, this is so true, specifically in the population of the inpatient setting, the ICU setting, where hospital psychosis is real and people experience it. There's only so much beige walls and dinging of monitors you can take before you lose your mind. Same thing goes for nurses who work in those environments. So you've got to come up with ways to really help our patients supplement their medical treatment in order to get better. Because if a patient is anxious, is stressed, their pain's going to be up, their blood pressure's going to be up, their pulse is going to be up, they're not going to be able to rest. Every symptom that they have is going to be 10 times worse. So it's really important for us to use those holistic interventions. Pet therapy at the Children's Hospital, I know pets are the best. Pets are the best. And you would be amazed at how pet therapy really helps patients, adults, children, our elderly patients in the nursing home. Who doesn't love a great dog that's sweet? I mean, really, who doesn't? If you don't, you probably don't have a heart. So it's important to know what options your hospital has. Be sensitive to your patient's needs. We have pet therapy at the Children's Hospital all the time. It's wonderful. I think the nurses probably benefit more from it than anybody, because just to pet a dog decreases your blood pressure, it decreases your heart rate. It just helps just give you a breath of fresh air. And so what's really interesting is with everything, there's always a nursing association associated with it, or a professional organization. So the American Holistic Nurses Association, just like the ANA maintains standards for traditional nursing practice, the American Holistic Nurses Association does the same for the holistic nursing practice. Okay, so we've got integrated nursing. Again, this is something that we do. It's where you bring in both parts of what we know, the traditional medical side, the alternative complementary therapies, and it really advances the health and well-being through caring and healing relationships. Again, nurses are so integral in setting up that trust, that relationship with the patient that really makes all the difference in their care. That trust is just so fundamental for everything that we do. It uses evidence, that integrated nursing uses evidence to inform traditional and emerging interventions that really support the whole person and the whole system healing. Again, Betty Neiman hit the nail on the head, God bless her. that she really understands that everything affects the patient, and to really provide the best care, we've got to understand each of those different spheres of influence. When we're thinking about complementary and alternative therapies, it's so very important for us to weigh the risk and benefit. Herbal supplements are awesome. Fish oil, CoQ10, BioFlex, all those things are great things, and they really do work for our patients. But it's important for us to understand what they do and how they affect our traditional allopathic medicine. We need to look and see what the research says. Is the research that backs up this theory? What is your personal experience? Have you had patients that have used alternative medicine that's really helped? And then what are their cultural influences? What beliefs do they hold that are going to affect how they see and view their health care? And that's really important for the nurse to do. Excuse me, that's gross. It's really important for the nurse to do because we're the ones that are communicating that to the physician. Okay, we have tons of time at the bedside. We have tons of time to establish that relationship, dive deep, ask those questions, time that they don't have. So if we have a patient that's using some of this complementary or alternative medicine, we need to make sure that we're in there asking questions and getting the whole picture of what's going on. The same thing if our patient needs it. If we've got a patient that's been in the hospital for 2 months and they haven't stepped outside, let's get them in a wheelchair and let's take them and sit them outside in the sun. Okay, let's go and find a CD player or something that we can play some music for them. Let's find a radio. Excuse me. All of those things are so very important to the well-being of our patients, and those are not traditional Western allopathic medicine type therapies. Okay, so now we get to talk about them. How many of y'all have really utilized relaxation therapy this semester? How many of y'all haven't had time to basically sleep, so relaxation therapy is the last thing on your mind? Okay, most of you, I figured. But remember that did y'all have to do a self-care project, the first part? I did. What I honestly did was waited until the last minute and just made something up. I really didn't do any self-care. Well, I found myself with anxiety, severe anxiety, second semester of nursing school. So much so that I wanted to go exercise, and I'm not an exerciser. When I wanted to go to the Healthplex in order to sit on the rowing machine to release my stress, I knew something was wrong. So I found myself in a deep pit of anxiety related to expectations and just different things. And so I had to seek the care of a medical person to help me deal with that. But it's so important to think about self-care for ourselves, but also for our patients. Relaxation therapy is great. I love the idea of just sitting and being still. That's so hard for some of us, specifically some of you millennials, where everything is just fast-paced. You're moving from one thing to the next. The idea of sitting still and deep breathing and just soaking in what your environment has is difficult for some people. So this may not be the best for everybody. So relaxation therapy involves arousal reduction. That means decreasing those stimuli. Progressive relaxation, that app that I played leads you through different breathing exercises to help you stop your mind, okay, and really just relax and just kind of step away. You've got passive relaxation. There are certain limitations related to relaxation therapy. Sometimes it doesn't work. Sometimes it's just not what's best for the person that's using it. So you may hit or miss as far as helping your patients really relax and step away and decrease that heart rate, decrease that blood pressure. It may not work for everybody. Okay, our next one is meditation and breathing. Again, my mind goes 90 to nothing, so meditation isn't necessarily the best for me. I find that specifically when I'm doing my quiet time or when I'm praying or when I'm journaling, there are 47,000 things that are going on in my mind, and I can't stop and focus on what I'm doing. So I have to have a little notepad over to the side where I write down, like, oh, go get milk. gotta go get my oil changed. Those are all things. Sorry, I just waved. There's somebody at my door. And so we sometimes it just doesn't work. Sorry, guys. Okay, so meditation sometimes doesn't work, but it does for some people. So clinical application, it lowers the oxygen consumption, reduces the respiratory and heart rate, it reduces anxiety, and it lowers your blood pressure. You need a great environment. You want a cool environment, dark sometimes, or at least these lights in here are terrible. I hate them. I hate them. I hate them. I hate them. After Christmas, if y'all come and visit me, I'm going to have Christmas lights from the ceiling to decrease that stimuli. Okay, these fluorescent lights are terrible. I hate them. I hate them. I hate them. I hate them. So you want to create that good therapeutic environment. You need it to be quiet. You want somebody in a comfortable position. You need somebody that's going to be receptive to it. You need some way to focus attention. So sometimes those meditations, like the app that kind of leads you through steps, it's going to be very beneficial to our patients. Okay. Again, there are some limitations. Again, I giggle. They may become hypertensive. It may enhance the effects of certain drugs. I feel like that's probably pretty rare. But again, if our patients have extensive, like Joan, if she has extensive, very, very high blood pressure, we need to get her on our medication immediately, and then implement these alternative and complementary therapies, and then take her off of her medicine. Okay, we want to make sure we put people's health first, or at least try to get them to understand where we're coming from. Okay, imagery. How many of y'all have sound apps at home where you have the wind or the rain or the waves? Those are great things to kind of move you out of where you really are and give you kind of a sense of peace, of relaxation. I love going to the beach. I love listening to it rain. So those are the two top noise machine maker things that I use. Okay. What's really interesting is it really does help with pain control. We use this a lot in the hospital with children, that distraction and imagery therapy. Get them to close their eyes. They can't see what's going on. We distract them and have them kind of take themselves away from where they are. It really does help with pain control. There are relatively few side effects. It alters gastric secretions, body chemistry, internal and superficial blood flow, wound healing, and heart rate. It's very interesting. So these are all great things that we can use. They're cheap. They're free. Imagery. Go for it. Okay, so we're back to sweet little Alonzo. He's working with Joan, and he needs to assess her needs. So he interviews her, asks her about her daily life, and discovers that she feels stressed at work and home. Me. Okay, Joan says that although her husband helps with her housework, oh boys, y'all better listen up. They have not required the children to do so. So Joan feels like she's on duty 24/7 because of the shopping, cooking, and housework, in addition to her job. Alonzo and Joan discuss how she can delegate some of her tasks to her children. Also, it's really important, specifically for women, men can compartmentalize. They're real great at that. Sometimes I wish I could do that. I'm not great at it. Women have a hard time doing that thing. We have nurses, particularly because we're so, we're all kind of perfectionists at some point. We'd much rather do things ourselves and delegate out tasks because we want it done our way. And so it's really important to make sure that we encourage our patients to delegate those tasks, talk about, at least start the conversation of how to do that. Okay? And so that will really help manage stress. Y'all, let's take about a 5-minute break. How long have I been talking? About 25 minutes. So let's take a little break, and then we'll be right back, okay?
Hey, can I help?
No, you can't help, Reese.
Is it like illegal?
Hey, guys, welcome back. Hope you enjoyed your cute little minute break. I'm back. I have students in here now, so if you see any strange children, it would be my students. They're in the 9th grade. Bless them. Bless them. Do you want to go ahead and introduce yourself, Reese?
I'm Reese.
He's just precious. She's going to pinch his cheeks and potentially strangle him at the same time. It's a very unique feeling. I love him, though. He's fresh. Okay, guys. So we're back to our case study with Alonzo, talking with Joan about ways to decrease her stress. It's really important to look at your patient's environment and see how you can help them manage stress, specifically if they've got those stress-induced conditions. Hypertension, they're not insomnia, all those different things that affect your life related to stress and anxiety. Okay, so training specific therapies. I found this interesting. I was looking at my notes and I said, requires extra training, ... Can't watch it on YouTube. So these are all things that require specific training by other licensed professionals. They're great ways, again, to really help your patients utilize, take a pass if you're leaving.
I'm going to the
Okay. Really to help your patients take advantage of some of those alternative medicine therapies. Acupuncture is awesome. I see it all the time. Cupping, if you remember from the Summer Olympics, Michael Phelps had those circular dots all over his back. That cupping helps. My sister-in-law uses it and loves it. She's an athletic trainer. Therapeutic touch, chiropractic therapy are all great ways to really help our patients maximize their health and their quality of life. Okay, biofeedback is just a mind-body techniques that uses instruments to kind of measure the response that your body gives to certain stimuli. It's a great way to help patients who've had that are in stroke recovery, smoking cessation, ADHD, epilepsy, GI issues, GU disorders. Because it kind of looks at the muscles and their response and your nervous system and their response to stimuli and gives it something, biofeedback, so that there can be changes made or treatments given to help with that. Acupuncture, I've never done it, but I think it will be awesome. It regulates and realigns your vital energy. It flows through channels or systems called meridians. It's a great way to really help with pain. It's really great with pain. As you can see on your slide, it's effective for pain management. It's also used to treat different disorders and varying effectiveness, arthritis, headaches, muscle pain. Acupuncture is awesome. I have friends, real athletic friends, that use it all the time and really, really live for it. They love it. It really helps with their muscle recovery and different things like that with their CrossFit competitions. Okay, so we're back to our case study about Joan. Even though our complementary and alternative medicine methods may help her blood pressure, she needs to make sure she takes her hypertensive medication. Specifically, if she's got stroke level hypertension, we want to make sure we get that under control immediately. And then we can use those alternative medicine therapies to help assist the medication. And then as those therapies help control it, then we can take her off her medicine. Okay? I said massage envy. It's a great thing. When y'all get into real life, making real money, definitely invest in some massage therapy. Okay, therapeutic touch. I love this idea of therapeutic touch. People need to be touched. It is just a part of who we are as people, and it's a great way to really help improve someone's well-being. Hugs. I love hugs. They're a great way to really do that touch therapy without, having to pay somebody to do it for you. I remember on Facebook several years ago, there was a lady who would go and cuddle with people. Like, that was her job. She would go and spoon with people. None of that frisky business. But she would just go and spoon because people just want to be held. They want that touch. They want that connection to another person. And therapeutic touch is a great way to help facilitate that. It treats pain, dementia, any type of trauma, anxiety. And it's just a great way to really help patients just connect and decrease that anxiety and stress. Okay, traditional Chinese medicine. It works on life and balance, it's health promotion. That idea of yin and yang is opposing and complementary forces that exist. Methods to evaluate a patient's condition. It's one of those things you have to be trained to do. You can't YouTube it and learn how to be a Chinese medicine person. They do it the same way that the healthcare does: observing, hearing, asking, interviewing, touching, palpating. It does have some therapeutic modalities specifically related to certain types of herbs. The most important thing about any type of alternative and complementary medicine is we've got to make sure that we know what our patients are using and that we communicate that, because some of these therapies can interfere with traditional medicine. And it's very important for us to know in depth what our patients are using as far as supplements, oils, any type of alternative medicine. Okay, now we're moving on to natural products and herbal therapies. Y'all have seen these. There's tons and tons and tons everywhere. You can sell them, you can buy them, you can grow them, whatever you want to. And they're just natural products, chemical compounds that really are used to help better the functioning of the body. Again, fish oil, I think about fish oil because I take fish oil to help with your cholesterol. B12 to help with energy, vitamin C to help with your immune system, melatonin to help with sleep. All of these things are natural products and herbs that we use to help make our body function better. It's interesting to know that herbal medicines are not approved for use as drugs and are not regulated by the FDA. So before you buy into a pyramid scheme about selling something, please be sure that you understand that the FDA does not regulate the production and selling of these medications or herbs and supplements. You want to make sure this is interesting. I want to make sure y'all can see this at the bottom. Look for the U.S. Pharmacopoeia Verified Dietary Supplement mark. Okay, that means that they have been assessed by a reputable source. Okay, back on to our case study. Joan's follow-up visit, Joan tells Alonzo that she would like to learn relaxation responses. Joan is excited about having control over a behavior that can help her manage her blood pressure, and so she eagerly learns. Joan reports that she and Thomas have assigned the children household duties, and so Joan had a free hour at night before she didn't know what to do with herself. So it's important to help facilitate our patients really understanding where they can make life changes in order to better manage their health. Okay, here's a quick quiz. An athletic young woman has just fractured her leg while training for a marathon. The use of meditation has many physiological properties that may help the young woman to, raise blood pressure, increase mood swings, increase oxygen consumption, or lower muscle tension. Okay, definitely going to be lower muscle tension. That's important with the fracture because you want those muscles to heal, and they heal best when they're relaxed. Okay. Last but not least, our final slide for the day, the integrated nursing role. Again, we've got to make sure that we know what our patients are using to make sure that our traditional Western medicine isn't going to interact with any of their herbal supplements or any of their other alternative medicine therapies. We need to encourage dialogue. We need to make sure we know what's going on with our patients. It's our responsibility to understand the benefits of these therapies and encourage active patient participation. There's no one-stop shop as far as fixing medical conditions. Diabetes, hypertension, obesity, glaucoma, all these different things all affect our well-being, and there's not just one pill that's going to make it better. We have to utilize these alternative and complementary therapies. We want to make sure, I love this idea of multiple practitioner approach. That multidisciplinary team is so very important to ensuring the quality of life for our patients. We want people involved that know what they're doing because we are not going to be experts about everything. It's very holistic in nature. It's also important to make sure you follow the Nurse Practice Act and scope of practice for your state. Remember, they do alter by state, they do change by state, so make sure that you know where you're at and what options that you have. Okay, and work closely with your patient. Again, that last point is just so very, very important. You've got to work closely with your patient. You've got to establish that trust to make sure that y'all are communicating effectively and making the right decisions about their care. I remember doing and seeing this lecture in nursing school. Please keep in mind it was like 14 years ago. And I was like, oh, this stuff is all crazy. Like, who does this? But as I've grown older and been exposed to the benefits of these alternative therapies, I know it's so very important for us to know what our patients are using, to give them options of alternative therapies besides just medicine, because sometimes medicine doesn't work exactly like it's supposed to. And there's lots of stuff out there nowadays. We just want to make sure that our patients know how to find good, reputable people to help them when we're not the experts. I hope you'll have a great Friday. Get some relaxation going on this weekend, maybe. I'm pretty sure y'all have a test on Tuesday, so y'all probably be studying. But I'll see y'all Monday in person. I know y'all are so excited about that. I'm teaching about electrolytes, so we'll be learning some fun and exciting stuff together. Y'all have a great Friday, and I'll see you soon.